Hi everyone, my name is Erin Hunter and I'm the senior editor here at Live Long Media. I'm really excited for today's conversation and I am talking to new author Rachael Piltch-Loeb. She is an assistant professor at CUNY School of Public Health in New York and she released a book called The Millennial Caregiver this May. It is a go-to resource for young caregivers and it's inspired by her own story of navigating caring with a parent with Alzheimer's when she was starting her late 20s and she was about to have a kiddo. But it's going to be a fabulous conversation, and I think it's going to apply to everyone who's been a caregiver at some point in their life, and you really don't want to miss it. So we're excited to welcome Rachel. All right, so I did want to start our discussion by just asking you about your book, why you wrote it, and a little bit of context and backstory.
Sure, absolutely. It's great to chat with you about it. And my book is called The Millennial Caregiver, Caring for Loved Ones During the Busiest Years of Your Life. And it was completely inspired by my experience, my family's experience caring for my dad, who was unfortunately diagnosed with early onset Alzheimer's at 58 and ultimately passed away when he was 61. So he wasn't I say he wasn't sick for that long. It felt like a long time, and a lot of life happened in those 3 years. But when he was diagnosed, I was in my, very late 20s. I have two siblings who were in their 20s. I was in the phase of life where I was having my first child. I was exploring kind of career development. And I felt completely lost for what to expect from this experience. It didn't feel like it was time to have an aging or ailing parent. And it didn't feel like there was a lot of resources out there dedicated to talking to younger caregivers. A lot of the caregiving literature, especially when it related to cognitive decline or Alzheimer's specifically, is focused on caregivers who are also aging or at a little bit of a different point in time of their life. Typically, because Alzheimer's and dementia or cognitive decline has occurred in older adults a bit more frequently. Um, but as I kind of sought that content and wasn't finding it, I sort of set out to create that resource that I wish I had, and that came about from doing some academic research. I'm a public health professor by background, so that part was familiar to me. From interviewing other folks who had been younger caregivers, either had kind of gone through that experience or were currently going through it, um, and trying to kind of pull together in a relatively quick format the various kind of aspects of life that are impacted when somebody is ailing. So everything from how do you navigate family conversations when not everybody's on the same page necessarily about what to
Mm.
do for their aging or ailing loved one, to thinking about having a healthcare proxy and long-term financial or legal planning that has to come up, and even kind of talking about grief and coping, or ambiguous grief that comes up when somebody is ailing but they're still alive. So trying to really touch on so many different components that were out there, and but focusing on a target audience that was younger and also managing sort of the development of life that's occurring, as you think about milestones that you want to hit as a younger adult. So that was the inspiration for the book, and that is the resource that came together. And it's the kind of most rewarding experience since it's been in existence, is being able to continue to connect with other folks who have been in this place or who are trying to kind of do work to improve caregiver support. And it's been a really welcome reception.
That's it's amazing because when I came across your book and I reached out to you, I never heard of anyone who had a resource for someone going through this at a younger than typical age. I never, it's not that I never thought about it, but it never struck me as something naively when you're younger. You're like, oh, I don't have to, I can put this on the back burner. It's
Yeah.
almost like it's not something that's front of mind, but then all of a sudden you're hit with it, and then it's the big question of, oh my goodness, where do I begin?
Yeah, I think that that's right. And I think, we are so used to going to Dr. Google or, WebMD or whatever it is, for all of our answers. And I think that one kind of challenge, even with the amount of information that's available to us online, is all bringing it all together to have that like holistic understanding of what you're going to encounter. And I think for younger generations, we are statistically a lot less likely to have like a primary care provider and regular kind of contact with the medical system. We are not yet necessarily in a phase where we're thinking about financial planning or like having a family lawyer who could draw up our will or whatever it is, because these we haven't been faced with these considerations. I think especially if you haven't, pursued home ownership, you haven't even thought about there are many reasons you wouldn't have even had an interaction with a lawyer for anything for yourself, right? And so I think that so much felt new, and yet there were so many different pieces to manage. So what I found was really lacking um, online was kind of some help to think about how all those different pieces were going to come up. So sometimes it's really hard to find answers if you don't know what questions to ask. And I think that the goal of the resource is to pull together different pieces that demonstrate the different domains that you may want to think about asking questions about, because they're going to come up during this caregiving experience.
So what was one of the hardest questions that you had to answer for yourself when it comes to providing the best care for your father, but also keeping a sane head with yourself? Because you can't, I feel like in life you can't spend all day swimming in research because you still have your own baby now to take care of
Yeah,
who's gonna come. Like
totally.
there's all these other aspects of life, and for a lot of people they can't dedicate they can't even dedicate the brain space to knowing what to even do.
Yeah, I think that's right. And I think, for me, there were, I think, different junctures or different kind of points in my dad's condition where we had to think about what we would do as a family. What would be those, I guess, inflection points that would make us kind of change our course of action. So, just to give you an example, we had to have early conversations and eventually take action of, when would it no longer be safe for him to live at home. Sometimes with
Mhm.
dementia patients, either they can't function in terms of tasks of daily living and they need physical help moving from place to place. He was still a capable guy and of able body. How could he maintain safety at home? There were times when there was a small flood in the house because he left the sink on, like little things that were coming up that we really had to be conscious of. How would we handle his safety? Um, and when we all still had to work, as you mentioned, and had kind of other familial responsibilities. Um, so I think that sometimes the hardest part of being a caregiver was trying to figure out how to navigate those like pivotal moments, and what they would be. And I think that the pivotal moments could look different for different families. Like for some families, there's just no option of somebody moving out of the house, either because culturally that's not in line with their value structure, right? Like they would do absolutely anything to keep them at home first and foremost. Um, that could be one reason. It could be because financially it doesn't make sense for the family to move somebody out of the house. If It could be because they are trying to kind of maintain that person's wishes, whatever it was. We kind of took the approach to try and navigate. When my dad was diagnosed with the disease, we had the opportunity to have some difficult conversations, but really um, relevant conversations with him about what his wishes were. Where did he want to be if he could no longer kind of, if his brain wasn't functioning in the way it was? What were the things that he wanted to try and participate in as long as possible? For him, that was seeing his grandchildren. He wanted to be home as long as it was safe. He wanted to continue to enjoy music. He loved to play the guitar, but we and he um wanted each of us to continue on as much as we could with our regular life. And he was a amazing dad and person, and he was so introspective to be able to kind of articulate some of that despite what he knew was coming. That in and of itself, those pain points I was talking about and those conversations with your own family and with your loved one are some of the most challenging moments that are really hard to give advice about, besides to say do it if you can, because you don't get the
Mm.
opportunity later on and the person declines, right? So if you don't expressly know what they want or have those conversations as a family, it doesn't get easier as the disease progresses. It gets much, much harder. And so I think the advice or the questions that were so critical to us were like, what would he want? What do we feel like we can safely do and financially and rationally do as a family? And how do we talk about this early on and keep talking about it so we can stay on the same page? And some of that, like navigation of our family dynamic, of his wishes, and of safety were really challenging, but really, really important.
Because it prevents a lot of grief in the future, it sounds.
I
You know,
think that's
it's
spot
kind of
on.
like
That's a great way to say it. It
mm,
prevents, or I think it doesn't make the future less painful, but it means you have a stronger support system and justification for why you're approaching it the way you did. And I feel like for all of us, we're searching for like somebody to give us the okay that we're doing this the right way. And I don't think there is a right way, but there is that feeling of like we're doing it together and we're doing what this person wanted. And that's the best way we can honor who they were and who they wanted to be.
that that's it's beautiful, and it speaks to something we talk a lot about in, not even we, the literature in longevity talks a lot about resilience. And
Yes.
resilience is a pillar of living a good life, right? And resilience is this idea that you're able to get through the tough moments and rather keep a certain semblance of mental strength and fortitude. And based off of hearing this, you and your family, it sounds as though that community aspect helped with your resilience in the face of his disease, because as much as it affected him, it affected all of you, and it very well could have had a serious impact up here if you weren't able to get through it, with
Yeah.
the right
I think
resources.
that that's spot on. I think that um, we think about kind of, there's the resilience of individuals, and then there's also the resilience of families and of community, and they're all tied together. But I think that for each family member who is going through this experience, um, you're everyone's bringing to the table, they're not becoming a new person just because this experience has happened, right? So you're kind of leading with who you were and how you approach the world, and then trying to seek and navigate things as you move forward and cope with this. And I think it's also important to recognize that some families, you can't expect that somebody's miraculously going to change because this diagnosis has occurred, and you want them to show up in a different
Mhm.
way, et cetera, right? And so we it's important to recognize that like the advice or the approaches that work for one family won't necessarily work for another, because they don't necessarily have that same baseline they're bringing to the table. And it does relate to this concept of resilience you're talking about, because in some ways resilience is, the ability to kind of navigate these difficult times and come out on the other side, and sometimes be stronger, or gain some skill set to move forward. um, but it also has a lot to do with what your baseline is and how you can bounce forward, or use that as a jumping off point. And I think we have to recognize that there are family dynamics that exist. There are health conditions that exist. There's mental health status, that are going to shape how resilient someone really is able to be in the face of kind of these circumstances. And that may mean that there's different resources they need to pull on to support them, whether that is family care navigators or mental health support, friends, siblings, loved ones, while coping with kind of being in the caregiving space.
Did when you were in the caregiving space, were there ever moments where you had to admit to yourself that you couldn't do something, or how did you experience those hesitations and moments of doubt? when
Yeah.
the going gets really tough and maybe there's a certain part of you that has to let go of the feeling that you have to be a Superman?
No, I think it's a great question. I would say yes, there was lots of those moments. But I think kind of generally speaking, when you there is the balance between being a present daughter and a present parent, right? I had little kids at home. And that is a hard balance to strike. It was not possible for me to be physically present with my dad as much as I would have liked to, because it was uprooting my kids' day-to-day life. And my job, right? I mean, I think for people, whether you parent or you don't, but if you work, um, if you have other commitments, there's a both a desire to drop everything that you do and kind of focus on your ailing loved one, and there is a reality that the other components of life have to continue, and they may continue after your loved one is no longer present, right? And I think, when I think about my mom, for example, kept working while my dad was sick. She is now still working, and had she given up her work, one, caregiving is really expensive, so that would have been a really challenging reality to navigate, and two, it's part of her identity and like facilitates her own mental acuity to keep working and being present in the work environment, right? So it's important that um to navigate that and to recognize it's not going to be possible to do everything, and it feels really challenging, I think, when you're in it, to feel like you're not just being present with your loved one. And yet there is so much of life that has to continue as well. And that's a hard balance. It's not even balance. That's a hard reality to cope with.
Mm. It's that realistic
Yeah.
self-care. Like
Yeah.
you gotta put on your oxygen mask first.
Totally.
Did you so in navigating this with young kiddos, did did it did they understand the gravity of how you felt or of who grandpa or papa what his condition was, or did that not
Yeah.
necessarily translate?
So my older son was uh when my dad passed away, my older son was about 3.5, and my younger son was, let's see, 8 months old. And my older son who is pretty emotionally astute. First of all, was really able to still connect with my dad while he was alive. They would, you know, listen to music or like walk around outside and pick up rocks, right? You recognize that children can still see people for who they are, and connect in really light ways. There was no pressure for my dad, who speech became difficult for, to have like a full-fledged conversation or to answer questions, which became stressful for him, with this child. It was just kind of being physically present, and he would be able to focus in on those moments with my son, often, and then sometimes he would trail off and be a little bit aloof, and there was another adult then present to make sure nothing was happening, toddler running away, but that was actually incredibly special to witness and to recognize that kids um are super powerful, like therapy for older adults, right? Or for folks who are declining. And so that joy and that levity that my son was able to bring to the situation was incredibly special. And when my dad ultimately was ailing and passed away, and my son, we had to kind of navigate that conversation with my son, who had spent time with him.
Mm,
The way we would talk about it was that, you know, or even prior to when he died, Papa's brain is not, or his head is not working. It's hurt. It's not going to get better. And, but he still loves playing with you, or he still, can give you big hugs and you can give him a kiss or whatever it is. And so we tried to explain it in relatively simple terms. But those are challenging concepts to grasp. And I have like the utmost respect for any family that has to navigate explaining kind of decline and death to a child, because there's such abstract concepts. For a while we articulated that, um, this wasn't going to get better, this wasn't going to change. And my son would say, but what about the ambulance, or what about the doctors, right? And so, that reality is hard to explain. All of that being said, what I really, really appreciated was that despite my dad's condition and my son's kind of limited understanding, my son has wonderfully fond memories still that he will articulate related to my dad. Papa liked red fish. My dad was obsessed with Swedish fish, for better or worse, for his health, right? And so, when we get them at the candy store, we talk about his memory. And so we still are able to bring in so many of those small things that, were part of their very brief relationship. And I think that the approach I took was to try and find those moments of connection and joy and facilitation, as painful as they occasionally were for me, because I was watching my dad not be able to be the grandparent that I envisioned him to be. I was watching my son ask, or at times get confused about, his condition. And I definitely questioned whether or not it was good for both of them. And then when you were there, or for me to just kind of take on that emotional balance in those interactions. But in retrospect, it was like the best thing that we did, because there are those memories, there are those moments, and I hold on to that so much, because my dad would have been a wonderful grandpa. He had like the patience of a saint. And so I again recognize it's different for every family and everyone's condition is different, but I think that it's hard to explain the pain of losing a parent to your own child, but the balance to that is seeing your whatever moments you can of your child interacting with that person before they're gone is incredibly important and special.
It sounds beautiful. It sounds special, and it's looking at the person who your dad was, and recognizing, even though the disease took him, he was patient, as you said, and
Yes.
he was still there, and his presence was still impactful, even despite the horrible disease that ended up getting him.
Yep.
And I think the one thing that really stuck out to me that you just said was your child explaining, why doesn't he take an ambulance? Why don't they put a Band-Aid on it? Because I think even as adults, whether it's even a spouse of someone who's going through, even if it's not a cognitive injury per se, but any injury as you're getting older, and these we're human, our bodies do break down, but it does sound like a very human thing to want to find the things to make it better, to
Yeah.
want to the resources, and
Right.
just
To
say,
fix the
oh,
situation.
can't we just do this? Were there any resources that were actually really impactful in this journey with you? Like, was it a certain doctor, or was it a certain um skill you learned from
Hmm.
YouTube? Like, what did
Yeah.
you learn that did help you along the way?
I think that we had a really good patient navigator for who was and a great kind of therapist who was for my dad, who was specialized in initially, the depression that comes with a diagnosis of this nature for patients. And I think that that was critical, because not only when you're diagnosed with something like this, or any kind of condition, there is the sinking feeling that kind of comes with, like, how am I supposed to live my life while I know this is happening? And I think that finding kind of therapy or support groups or whatever it is that is focused on that, like as the individual who's been diagnosed, can be so helpful, because it is a really distinct kind of form of feeling and emotion that comes with it. And I think similarly for myself and for my siblings, like finding a care support group online that was focused kind of for children who were in this situation was really valuable. I think one of the things that's really challenging about like a debilitating diagnosis is expectation management. Like, you don't necessarily know where it's going to go and how and why. And so that's why, those patient navigators, if they exist, for somebody who are able to kind of give you some semblance of what your timeline looks like, what things could come up with the disease are invaluable. So we were lucky that we did have one of those as part of my dad's care team. I think it was fascinating to learn about some of the therapies that are out there to try and support a, folks who are going through this, whether that's like occupational therapy or music therapy, art therapy. Sometimes it's working with kids, to improve their quality of life and condition. And all of those were kind of valuable learning experiences in terms of resources that are out there. I would say this is like very minor, but again, relevant to folks regardless of if it's cognitive or physical, but recognizing the ways in which medication management can be made easier was really, really helpful. My dad was on tons of pills, morning, midday, evening, and he would forget to take them. So we would like find them in random places. So the fact that your pharmacist or your a medication management company, if your local pharmacist can't do it, can put together your pill packs and make them separate them out in different ways depending on what the condition is and what the person is capable of doing independently or with help. Because we got to a point at one before, even once the medication was organized, where it would require like a person to be with him until all the medication was taken. And that could take a long time because of the ways in which the pills needed to be taken and contraindications and what he could swallow. And so I think it was helpful to discover different resources that were out there specifically around medication management and packaging and support in that way. Again, a very minor example, but I think, there are these small resources that can make the day to day a little bit easier to cope with.
It's the lifestyle piece of it.
Hmm.
It is the day-to-day, it sounds. Can you really quickly describe how and what the patient navigator is and what how much it costs, the resources, the concept behind it?
Yeah. So, our experience with the patient navigator was as a result of the diagnosis and the care approach that was taken at the clinician's office that my dad was based. And so I think that oftentimes patient navigators are made available by a healthcare system or a particular physician team for complicated conditions that are likely going to require you to see a variety of different specialists. So he needed a neurologist. He also needed a cardiologist because he had a history of just having a heart condition. He had his primary care doctor. Um, there were different types of folks within the neurology team that were monitoring his condition who had different specialties, right? And so that their office that specialized in his case in particular in early onset Alzheimer's utilized social workers within the office to try and more effectively manage care. I know Medicaid, for example, or Medicare, excuse me, has created the guide model, which they're trying to implement to try and improve kind of the care around Alzheimer's and dementia, and is intended to help with care navigation across different providers and where healthcare teams are being incentivized to work together essentially to support patients. And so there have been this creation of patient navigators. Again, Medicare, it would be for those 65 and older. But this model of trying to do better to support the different care needs of an Alzheimer's patient is relatively novel, but hopefully the way in which the care is evolving. Um, and at the most basic level, it can look like a social worker working with a doctor. There are private pay patient navigators, but we happen to have one that was part of the care team that my dad was seeing in the Massachusetts area.
That's awesome. It sounds like palliative care a little bit.
Yeah, often palliative care is typically more like to keep somebody comfortable and do the other stuff around, right?
Okay.
The actual sorry, my head's big. The actual diagnosis, but this is more almost care coordination, like a care coordinator, um,
Oh.
a little bit to because one way in which this could play out. if you don't have somebody who's looking across your medical team, if you need to see different specialists, is like one doctor might prescribe you one medication, the other doctor might prescribe you a different medication. You can't actually take those medications together, but if those doctors never speak to each other, then you're up a creek. And so that's a very basic example, but oftentimes we were seeing this patient navigator to help guide our family around kind of the expected trajectory given the conditions. And they kind of serve as that better communicator to family
Mhm.
across the medical team, because oftentimes doctors are not, that's not what they're trained in. And that's also not necessarily what they're being paid to do based on our like medical model. Like they're being paid to see the patient, make a diagnosis, um, and work on the clinical side, but not necessarily to then do that family counseling. But we recognize that if you don't counsel the family, then the patient may never actually get what they need. And
Mm,
so I think there's, the medical system in general, through either the ways in which Medicare reimbursement or insurance reimbursement is changing, or through the way healthcare systems are trying to also better support patients and find out where they can um, reduce some burden. Like, again, just to play this out, let's say a patient goes and sees a doctor, the doctor makes a recommendation, but the patient's not capable for caring for themselves and nobody ever tells the family. The patient then comes back and has to go to the emergency room because they weren't taking their very simple intervention seriously. And the hospital realizes, hey, it's a lot cheaper to just hire someone to talk with all these families than it is to have patients continue to show up to RER. And so it's,
mm.
these are approaches that are being tried in a lot of locations where it's a lot easier to proactively, preventatively, essentially, use care navigators, patient navigators to talk with families to support patients than it is for patients to not really be able to support themselves and them to end up in a hospital or needing the emergency room.
Did any of the medications help more than others? What and
Yeah, I
even
don't I don't exactly remember, to be honest, like the names and the
yeah.
but I think that there were junctures where we would kind of go down a path and then around medication, and there was one, and I can't recall the name of the drug, that was intended to help manage some of the cognitive decline, but was making him extremely sick that he couldn't that he couldn't necessarily function in day-to-day living. And then it becomes a balance of, okay, well, am I delaying my decline by a month or two, or they don't really know, over being able to function while I have my facility, my capabilities. And that balance is really hard, and it's going to come up to an individual. So I think getting it right is going to vary from person to person, and also depend on some of your underlying condition stuff.
Yeah, that's
My dad
a
also wasn't eligible for some kind of more novel treatments because they were only approved for folks over 65. Um, and so
oh
that's another
gee.
thing to just recognize when you're thinking about kind of medication and what can be prescribed to different populations and different audiences. There are sometimes limitations around this when a condition has not been perceived to affect certain populations more than others. It's not FDA approved for certain populations versus others because they don't do trials on under 65 for Alzheimer's drugs. So, and this is evolving, the world of clinical trials and medication management, but that was definitely a small challenge that we encountered as well.
I'm that is so tough. That
Yeah,
is so tough to hear because I mean, they do all the trials. Like, why not? What's the harm? And I
right,
mean, I guess the harm is obviously drug interactions, but if a person has a disease, like, wouldn't you say if it is what could be a terminal illness, why not just let them try?
right.
Ay, ay, ay. Um, well, I just want to, as we're winding down here, I would love, and only if you feel comfortable sharing, if how this has impacted how you're living your life going forward. And
Yeah,
has life looked differently for you or the way
it's
you
a good
approach?
question. Yes and no. I mean, I think that I do my best to try and kind of incorporate, what my dad would have been like in my day-to-day living. And some of that was prioritizing family, being patient, being present, meeting your kids where they're at. My dad, he worked and he cared about his career, but he really his number one priority was us and being kind of a present parent and balancing at times with my mom and their reflective work schedules. So I think that kind of remembering that life is about, family and the people who are going to remember you the most when you're gone are the people you're closest to. So prioritizing those relationships is something I try and think about as much as, career development and trajectory are also, important to me. Um, so I think I try and reflect his values and his approaches in my day-to-day parenting sometimes, which is challenging to have patience with, two, three children on five and under. But in my day-to-day parenting and in just kind of overall approach to prioritizing kind of time and relationships. So I don't know that that necessarily looks different, but those kind of moments of reflection are obviously there in a way they wouldn't have been otherwise. And I think, similarly with my siblings and with my mom, trying to continue to make time with each other a priority, it is critical. The creation of the book obviously happened as a result of this experience, and so I continue to feel passionate about this space of caregiver support and trying to think about ways to improve the way we care for folks as they age, and can improve our approaches to long-term care, both how expensive it is, how emotionally taxing and physically taxing it is. I don't have any wonderful answers, but I think that just being so much more aware of that space at this juncture in my life, is a result of this experience as well.
Thank you for sharing it
Yeah.
that and I'm glad the book exists and we'll
Yeah. Thank you.
provide a link to it. But I appreciate you being open and sharing because I think a lot of folks who go through the caregiving experience, which I think I saw a statistic is 53 million people, something along
Yeah.
that lines, are unpaid caregivers. And you don't hear so much about what they're going through. And that I'm glad there's talk about that because I think it's still finding moments of joy and being able to move on
Hmm.
with life is applicable to everyone, even
Totally.
people who are caring for any condition, a child, anything in life. There's strains that come with it. And so
Totally.
you helping map it out, I think that's awesome.
Thank you. And I think that you're right in acknowledging that I think there are so many folks who are in this position. It's something we often don't talk about because it feels really challenging and it's not like as common as oh, well, let's talk about our kids, and you think that if there's a problem with your kid it's going to get better, whereas when you're in a caregiving space, when you have crappy moments, it just sits there, right? But we need to normalize this, like, because it's more and more common in society, and it's going to continue to come up. So I think that these conversations are just important to help get there.
Oh man, awesome. Well, I appreciate your time being here and
Yeah, thank you, Erin.
I just think that it's it's a good thing. You did a good
Thank
thing.
you. Thank you.
Not that
It's
my
been great to talk to you.
opinion is like
No, I appreciate it. That
but
that's the
but no, I appreciate you being here. Thank you for sharing. And
thank
I know
you.
everyone's gonna resonate in some capacity with it because I think we've all had a caregiver role, even if only for a moment at some
Yeah,
point in our lives.
yeah, absolutely. Thank you.
Oh, thank you so much.